Hi, Billy McClean, Head of Community Health and Care Services here for the weekly vlog. Happy New Year, welcome to 2022. Hopefully 2022 is a bit easier than 2021 and 2020, but we're not starting the year in a good place. It's a pretty challenging position just now, as people will know. Lots of people off with COVID or self-isolating. That's really what we anticipated as we went into Christmas, and that's exactly what we're finding. So high levels of sickness absence across the system, and also absence and vacancies across the system for other reasons too, which means that a good number of our teams across community and acute services are really finding it difficult to provide services. We are also starting to see the number of people who have got COVID coming into hospital and being admitted rising. So we've got between 90 and 100 people across both acute sites now in hospital with COVID. We're anticipating that that'll increase to 170, 180 people by next week, and obviously increase further the week after. So a really challenging few weeks ahead of all of us. And with that in mind, the big topic of conversation, unsurprisingly, has been around workforce and what we are going to do over that 3 or 4 week period where things are going to be very challenging. That's going to mean a number of us, including me and the senior team, directorate management team, are starting to think about where we might be lending a hand. So where I might be coming down and helping out on a ward, or helping out in community services, or helping out in non-patient facing, service user facing jobs, but ones that then free others up to be able to do that patient facing work. So I might well be finding myself putting my physio uniform back on and lending a hand somewhere over the course of the next few weeks. It might be that if you're in a non-patient facing role, that you're also asked to go and provide some support to patient facing services. So a really difficult few weeks ahead, but I'm sure that we'll get through it together, and that we'll then start to see those numbers improve, people starting to return to work and so on. And it will be a little easier over the coming few weeks because of the reduction in isolation period. So hopefully that will help us out a little as well, and hopefully help get us through the spike that we're anticipating. The other big issue for us around some of the challenges just now are the number of care homes that are closed with outbreaks. So we've got roughly half of our care homes are currently closed with outbreaks, and that's causing real challenges around our delayed transfers of care and supporting people to leave acute hospital and be able to move closer to home, either into a home or into a care home. So again, something that we're needing to just work on over the coming period. So as I say, tough start to the year, but what we're anticipating is that will be relatively short-lived, and then we can get hopefully back into a rhythm around improvement work and so on during 2022. I hope that people have managed to have a bit of a rest, and that you've managed to spend some time with friends and family over the Christmas period, so that you at least are re-energized, ready for this tough spell, and hopefully we'll start to see those improvements over the next few weeks. Okay, well, if you have any questions, any thoughts, any comments that you want including in the vlog, please get in touch in the usual way, and until next week, I'll speak to you then.